And doctor, in regards to the postmortem examination of Ms. Belt, what was determined to be the manner of death?
The manner of death in this case is a homicide.
And homicide simply means the death of an individual at the hands of another. Is that correct?
That's correct.
And what was the cause of death found by Dr. Giles?
The cause of death, in his opinion, was a firearm and charge force injuries of head and neck.
And in regards to that report, did Dr. Giles list specific findings in regards to his examination of Ms. Belt?
Yes, he did.
If you would go over with the ladies and gentlemen of the jury what the findings were in regards to Ms. Belt's injuries.
He did document two gunshot wounds to the head, a stab wound, and other injuries. Starting from the gunshot wound, he did saw a gunshot wound on the top front part of the head on the left side. The range of fire was undetermined.
Next, in regards to the first gunshot wound to the head, where was the entrance of that wound?
It was on the top front part of the forehead.
And the direction of travel of the projectile?
It penetrates through the head, and it was going from front to back on her body, from left to right, and from head to toe, so it was going downward.
Was there an exit wound from this first gunshot?
No.
Next, in regards to the second gunshot wound to the head, if you can go through the specifics of that injury.
Basically, it's another gunshot wound, and it was on the eyelid on the top outside, like I'm pointing on more or less, and perforate the eye, perforate the skull, and it went through the brain and ended on the side to the back, kind of front to back, left to right, and slightly upward.
And when we say gunshot 1 and gunshot 2, from the findings in this report, that's not chronological. You can't tell if one was before the other in this case, is that correct?
On rare occasions, you can tell in the head, for example, not in this case, but if you have a gunshot wound in one area and then a second gunshot wound in another area, the first gunshot wound is going to create fractures that stem from that, and the second gunshot wound is going to create fractures, but it's going to stop with the other fracture that was there prior to that. In this case, they were apart, and there was no connecting fractures to determine which one was first or second.
So when we call them gunshot 1 and gunshot 2, that's just designating them. If we would have called them gunshot A, gunshot B, it's not in regards to time of event.
Most of us usually select top to bottom when we are going through injuries. Some can do it in reverse, but it's no order how they happen.
Next, in regards to, was there a stab wound on the left neck of Ms. Belt?
Yes, it was.
And what was the information gathered in regards to that one?
Basically, it was consistent with a single blade passing downward, slightly rightward, so from left to right, and it's slightly posterior, passing into the upper left thoracic cavity with a tiny upper puncture to the left lung, and a slightly lung and pleural hemorrhage. So basically it was on the front, and it went down and passed through the soft tissue between the collarbone over there and entered to the cavity, and the upper lobe of that lung got incised or cut, and there was hemorrhage associated with it.